Okay, there we go. So we left off here looking at the anatomy of the nervous system, the divisions of the autonomic nervous system. And I think we got to just beginning to speak about the different fibers that are involved here. Okay, so we kind of left off on this slide, I believe. And we were talking about the gray ramus versus white ramus fibers and how the fibers of the autonomic nervous system, they are myelinated when they first enter the spinal nerve, but then when they leave the ganglia and re-enter the spinal nerve, they're unmyelinated, and so we call them, hang on, let's pull this up. Let's actually illustrate this here. All right. Oops. All right, so we were illustrating the anatomy of the sympathetic nervous system. And just to remind ourselves here, we've got the cross section of the spinal cord. This is the segment where these fibers arise. And we've got the dorsal horn, the lateral horn here, and then we've also got the ventral horn, right? And so we mentioned that the fibers always arise from the lateral horn. But that they use the ventral root as a point of exit. So from the segment here of the spinal cord, we've got two roots that are making their way to become the spinal nerve. We've got the dorsal root and the ventral root. So there's no lateral root. All right, let's kind of label these out here. So we've got a dorsal root, and we've got a ventral root. Okay. And just to kind of make a connection here, this is the space, the intervertebral foramen. If you remember that space in between the vertebra that we looked at in the anatomy labs, this is where these spinal, roots are exiting and emerging to join the spinal nerve, okay? So the fibers of the autonomic nervous system, the sympathetic system, the thoracolumbar fibers, have to use the ventral root as a point to exit and join the spinal nerve. Now, when they're joining at this point, they are myelinated, and so we can call them white ramus fibers. We talked about the presence of myelin creating this white coat around fibers, and so we can call them white ramus if they are myelinated. And then they're going to emerge. Let's kind of finish up this here. So these two fibers join together here. They synapse at a ganglia. We talked about a ganglia being really close to the spinal cord, to the area where these fibers are originating. And then they're going to leave the ganglia and re-emerge back into the spinal nerve. All right. So here's our autonomic ganglia. And so I'm going to continue to draw this in red, representing that it's myelinated. But then when it synapses here, let's change the color to blue, because this is no longer myelinated. And we can call this gray ramus beyond this point. When it reemerges into the spinal nerve, it's now considered an unmyelinated fiber. And we're going to call this gray ramus or a gray rami. Alrighty, and let's just make a note that this is the spinal nerve itself. And then this would be considered the preganglionic neuron, and then this would be considered the postganglionic. Okay, so this is the anatomy of the sympathetic fibers and how they synapse onto this autonomic ganglia really close to the spinal cord, which could be a part of the sympathetic chain. So let's not forget that anatomy, that this is one of three options for the synapse of a preganglionic sympathetic fiber. And then when it leaves the synapse, it's going to reemerge into the spinal nerve. At this point, it's no longer myelinated. It appears gray because it doesn't have that myelin. And so we can call it a gray ramus fiber here. Very, very important. A lot of students mix this up. We're going to talk about the ventral horn of the spinal cord, which is this region. The somatic nervous system, the fibers arise from the ventral horn, but they also use the ventral root as a point of exit. So do not confuse the area of the spinal cord where the autonomic fibers arise, which is the lateral horn, with the ventral horn, although the lateral horn fibers are using the ventral root as well, okay? So really important distinction here to make. Autonomic nervous system, fibers arising from the lateral horn, using the ventral root to exit. Somatic nervous system, which we'll talk about, fibers arising from the ventral root, but also using, the ventral horn, but also using the ventral root as a point of exit, okay? Alrighty. Any questions here? Any misunderstandings, any clarifications? Let's save this. Okay, let's go ahead and keep it moving here. Before I kind of keep going, I got two really important questions over the weekend that I'm going to address here. Okay. The first one was, why are the fibers, like there was confusion between which fibers are longer, which are shorter. And then the second part of the question is, why does that matter? Why is that important? And so I'll go back here briefly to this schematic, really good schematic for you to study from, by the way. So I would encourage you to print this out and kind of fill in the gaps here, fill in some notes in this image to give yourself some clarity. But looking at this image, the reason that, first of all, let's review why the different fibers have different lengths. So we talked about the fibers of the sympathetic system arising from the thoracolumbar region, so T1 to L2, synapsing onto a ganglia, usually really close to the spinal cord. So one of the options for synapsing was a part of the sympathetic chain. And so we can see here that it's very close in proximity to where the fibers arise. And so this is a shorter neuron, just physically, right? Just very close proximity here. The second part of the neuron, which we just described, right, that unmyelinated bit, the gray ramus fiber, arises from the synapse, and then it travels all the way out to these effector organs. These organs can be as far as the lungs, the heart, the liver, and some of the GI organs. And so we can see physically this is a much longer distance to travel. So that kind of just explains the anatomy of the length of the two neurons for the sympathetic system. Now, the reason for this is to create a more widespread, more diffuse response more rapidly, okay? Because we have synapsing early and very close to the spinal cord. And then we have this branching. So we can see that although there's one synaptic communication to this ganglia, and although we've been drawing it out and describing it as like a one-to-one event, we want to think that it's a little bit more complex than that. So at this ganglia, there are many synapses that are leaving the ganglia and are going out to the various effector organs. And so this creates this diffusion of the response, and that allows for it to happen very quickly, very rapidly. And if we kind of zoom out and think about the function of the sympathetic nervous system, that's ideal. That's what we want in a fight or flight or freeze response, okay? Likewise with the, when we think about the adrenal medulla and the synapse onto the chromaffin cells, and then the flooding of the entire body system via the vasculature with these hormones that are acting like postganglionic signals, okay? And that too is to aid the sympathetic system in creating a more diffuse, more widespread, more rapid response. When we think about the parasympathetic system, we can kind of contrast that anatomy. So we've got fibers arising from brainstem and the sacral region of the spinal cord, traveling all the way out very far to the ganglia that are near to the organs that they're trying to innervate. So for example, we can think about the otic ganglia, which is a ganglia that's really close to the salivary glands. And so the facial nerve is going to arise from the brainstem. It's going to travel all the way out to the otic ganglia, which is somewhere around the mandibular region in the cheek. And then from that otic ganglia, there's going to be a second neuron that synapses very short distance to the salivary glands themselves. Okay, and again, the anatomy here, or the intention behind the anatomy, is that we have not so much of a diffuse response. We've got a more specific response, a more controlled response with the parasympathetic system. And so when we slow down things like the heart rate, the respiratory rate, the salivary secretions, it's going to be in a more controlled way than it is when we speed up the heart rate, speed up the respiratory rate, and we have a sympathetic response, which needs, for obvious reasons, needs to be fast, needs to be widespread and diffuse. Okay, so just to kind of make some connections there behind the anatomy and the function of the system and the intention behind that anatomy. Okay. Yeah, so let's kind of keep going here, and let's talk about the anatomy of the parasympathetic system, and then kind of carry on that conversation in contrasting the anatomy of the two. So in the parasympathetic system, we've got these preganglionic neurons. They are arising from the brainstem and the sacral region of the spinal cord. Just to reiterate here, they're much longer preganglionic neurons and much shorter postganglionic neurons because of the anatomy that we just described. So let's look at the examples here, or the actual nerves that are part of the parasympathetic fibers. So they are cranial nerves 3, 7, 9, and 10, which are the oculomotor, facial, glossopharyngeal, and vagus, okay? And just to use vagus, for example, the vagus nerve is a very long nerve, very important nerve. It arises in the brainstem. It innervates muscles in the larynx, muscles in the pharynx. It innervates the heart, the lungs, the gut, all the way from the stomach, all the way down to the distal parts of the intestine. So the vagus nerve is a very active nerve. It's a very long nerve. And as we can see, it's going to synapse out to ganglia that are closer to the exact areas that it's trying to innervate. So we don't have that long preganglionic fiber the way that we saw in the sympathetic system. Instead, we've got this really long preganglionic nerve. So the vagus nerve itself is a preganglionic fiber. And then it will synapse onto, let's say, the cardiac ganglia, and then have a shorter nerve that goes to the heart. The respiratory ganglia has a shorter nerve that goes to the lungs, ganglia that's close to the stomach, the celiac ganglia, which then goes a shorter distance to the stomach itself. All right. And again, that is giving us a more controlled, more fixed, more specific response in the parasympathetic system. Now, I want to draw some attention here to the spinal nerves and make a distinction between the spinal nerves and the pelvic nerves that are associated with the sacral region of the spinal cord. I get a lot of students confusing these two. And so let's just make this clarification here. So the spinal nerves that we're speaking about are sacral segments, S2, S3, S4, and not the somatic spinal nerves in the region. So we also have S2, S3, S4 fibers that, for example, are part of the sciatic nerve, but that is a somatic nerve that's going to be innervating skeletal muscles. So your quads, not your quads, your hamstrings, etc. So we want to make a distinction between the somatic nerves, which are spinal nerves. And I think the confusion that most students have is the S in spinal nerves and the S and sacral nerves, right? So the S and sacral are pelvic nerves, whereas spinal nerves are somatic nerves, okay? So just to make that clarification here. And so the pelvic nerves are going to be autonomic nerves. They're going to innervate the smooth muscle of the bladder, the rectum, the genitalia, whereas the somatic nerves are going to be innervating skeletal muscle and not a part of the autonomic innervation here. Right. Let's talk a bit about the mixed composition of our autonomic nerves. So our autonomic nerves actually have fibers that are traveling in both directions. So there are efferent fibers. These are the fibers we've been looking at so far. They're coming from the spinal cord or brainstem. And they're traveling outwards to the effector organs, right? We've got preganglionic, postganglionic. Those are efferent fibers, fibers that are going from central nervous system outward. We can also consider as a part of these nerves that there are also fibers that are traveling in the opposite direction. These are called afferent fibers with an A. And the afferent fibers are actually picking up sensory information. And when I say sensory, not actual perception that I'm thinking about, but more baroreceptors, chemoreceptors, visceral receptors that are taking information that I'm probably not even aware of cognitively up towards the central nervous system, making important adjustments or decisions about blood pressure, about pH, about temperature. And then the response is going to be sent on an efferent fiber with an E. So afferent fibers are fibers heading towards the central nervous system, and then efferent fibers are fibers that are going in the opposite direction that are bringing back the response or the effect, hence the word efferent, out towards those organs, and a really important function of homeostasis, as we would imagine, right? The sensory bit that's taking information up, as well as the efferent bit that's taking information back, are both involved in maintaining homeostasis.